Tell a friend to tell a friend. Ultimate Health is on. Today I take a close look. Yes, I zoom in, go up close and personal with the National Blood Service. They say safe blood saves lives. Yeah, one of the miracles he makes happen each and every time for us. Blood. Something we take for granted. But today I'll be taking a close look at the service itself. Personnel, infrastructure, new developments, new partnerships and collaborations. I have in the studio Dr. Lucy Asamoah Akwoku. She is the head of research and development at the National Blood Service. Stephen Adaiba is the head of PR and communications. I have a lovely donor, yes, a blood donor, Josephine Anand Dennis, with us in the studio. If you have any questions and concerns about blood donation, new developments, WhatsApp is 055 11 11 997 on Joy 99.7 FM.
It's God's beat maker.
Well, you may hear every year in, year out, we need to emphasize on voluntary blood donation. And that's supposed to be safe. My reading suggests that the statistics don't exactly tell us we're making gains in that regard. So we hope to understand all that as I engage the officials of the blood service and, of course, a blood donor. Ladies and gentlemen, you're most welcome to the studio. I hope you can hear me. Yep.
Yes.
Okay. Right. So let me start with you, Dr. Lucy Asamoah Akwoku. The National Blood Service, right? We always hear of blood donation, blood drives, blood campaigns. But just bring us up to speed with what the National Blood Service is. And then if you could give us kind of a state of the service, right? Where we are.
Thank you very much, Nortey. So the National Blood Service in Ghana is an agency of the Ministry of Health, and the service has the mandate to ensure the availability of safe and adequate blood and blood products and make it accessible to patients that require that in all health facilities in the country.
Okay.
Thank you.
Right. So you make available safe blood across the country. Right. So if you could help my listeners and bring us up to speed. What we know, very often we hear of the National Blood Service, unfortunately, when it itself needs help. Right. What is the current status? Are we in a good shape with regard to stocks, especially with regard to the current COVID-19 circumstances?
With regards to stocks, no, we are not in a good shape, and I am not sure that we have been in a very good shape at any time. We always collecting much less blood than we need for our patients in the country.
Okay, so we have less blood than we need.
Yes.
Can I pin you down to specifics? How much blood do we have and how much do we need on an annual, regular basis? I'm trying to put up a little document I have here, but how much blood do we need as a country of 30 million plus people? Okay,
so the way we estimate our blood needs is that WHO has a recommendation that we use a calculation of 1% of the population. That is the minimum requirement. So if we are looking at Ghana, for example, for 2019, where the population is 30 million, we need 300,000 units of blood.
Okay. And how much do we actually collect and store?
So just a little background to that. We need 300,000, and our aim is to collect all of that from voluntary blood donors. For 2019, as an example, we collected about 60% of that. That translates into about 180,000 units of blood, and only 33% of that came from voluntary donors.
Okay.
So that is pre-COVID. That's the situation.
Right, and I've seen some recent data which quotes the your chief executive, Dr. Justina Tete, which says that we've had a drop in is it voluntary donation or in total volumes of about 21%.
Yeah, that's about 55% for voluntary donations.
Right.
And about 27% for family replacement. When we look at the first 9 months of the year compared to the first 9 months of last year.
Okay. All right. I'll come back to those specifics. And for you listeners, voluntary donors are those who just, out of altruism, right? They go and they donate their blood. We'll go into the procedures and the processes of blood donation shortly. Family replacement means that when you access the blood service, you are required to replace blood, right? As it were, on demand. And this is not the desirable practice, okay? And my guest will explain why it's desirable to have voluntary donors being in the majority as against the family replacement. If you have any questions and concerns about the blood service or blood donation or access to blood, good safe blood, my WhatsApp is 055 1111 997. This is Ultimate Health on Joy 99.7 FM. Let me come to you, Josephine. You are a blood donor, right? My understanding is that you've been a blood donor since 2005. Can you just share with my listeners before I come back to the nitty gritty? What motivated you to become a blood donor?
Okay, thank you, Doc. My first donation was in 2005 when I was in the university.
Okay.
At the time, I was quite young and I didn't know the real motive for donating blood. But I'm a Catholic and we had a Pax Week celebration. So during that period, there was a blood donation exercise and I felt I should give blood because we were told that it saves lives.
Okay.
And just before that, I remembered an incident that happened to a friend of mine. She lost her brother through a road accident. And in the course of that, he lost so much blood. And at the hospital, they couldn't get blood for transfusion and the brother died. So I remember that incident and it pushed me to do my first blood donation. Okay. And after that, when I had children at the hospital, I also saw women who went through labor, had challenges, and lost their babies or lost their lives because they had bled so blood. Much and they couldn't be transfused with blood to save their lives. So all these experiences added up and motivated me to do it a few times more. Right.
Okay. So since 2005, you donate once a year or how many times do you donate?
No, as and when. Yes. Okay. So the last one was in June. I'm a staff of Leicester Hospital.
Okay.
And I'm taking this opportunity to say hello to our CEO, Dr. Hiaji.
Right.
And all the staff who will be listening at this time.
Okay.
We had a campaign for blood donation, which we dubbed the 100 pints of blood.
Mm-hmm.
So we encourage staff to all come around and donate some blood to inform our clients about the need to donate blood.
Okay.
And to tell our friends and families to also come and help in the blood donation exercise.
Okay.
So during the period, we were at the rife of the COVID pandemic, and so we got information from the blood service that they needed more blood.
Mm-hmm.
And our business development unit, led by Mrs. Efwadazi, led the campaign for blood donation. So during that period, staff and clients were encouraged to donate blood to support the blood bank, and we were able to achieve our targets in June.
Right, great. Okay, and from time to time, the blood service, let me bring this to Stephen, organizes blood drives and campaigns, right, amongst groups, and of course, individuals can also, on a voluntary basis, come forward and donate. How is this going? What's the response? For a lot of people, and I'm sure you get this when I open the phone lines and start reading WhatsApp messages, it doesn't happen as naturally as Josephine is describing. How is it going with the blood campaigns and the drives?
Well, I must say that the campaign was going well before the COVID, sets in. What we usually do is, like Josephine explained, we collaborate with institutions and organizations to do this blood drives and campaigns.
Okay.
So before an organization would want to donate blood or add blood donation to any activity that you're organizing, they write to the National Blood Service. And then we also organize a public education campaign for them, just to educate the people who will be coming to donate blood, to know the do's and don'ts about blood donation, which I think is very, very important. We want to sensitize the people to know the reason why they should give blood and all that. So the drive, well, I must say that before the COVID, like I indicated, was going well until the COVID set in. And usually what happens is that, the campaign has to do with organized groups.
Right.
And but because of the restrictions on activities or movements, yes, we couldn't
protocols
do
and all
enough of these campaigns this year.
But Stephen, I mean, and maybe to you and your deputy CEO or head of research, is that to suggest that before COVID we were sitting pretty, we were doing well? Because have we ever had the situation where the National Blood Service is comfortable with the stock of blood and the replacement of that stock?
No, we haven't had that. So as I explained to you, given an example of 2019, we have had, we've been collecting around 60% of what we require in a year. And if a lot of that is coming from family replacement donations, then that means that we are not where we want to be.
Okay, right. So we weren't exactly okay, but COVID definitely has worsened the situation.
Absolutely.
All right. Let me ask you, as head of research and development, what can you say to our listeners about your role during the COVID, and then the challenges you've faced, and then what you've put in place to make sure that people can still donate and access blood with a clear guarantee of safety?
Okay. So during COVID, we still had patients who had other health conditions and needed blood, although COVID itself has not been associated with a lot of blood transfusions. However, once the first case of COVID was reported, there was fear, there was public anxiety, and then donors got scared. All our mobile sessions were cancelled. Following that were the preventive measures, social distancing, ban on gatherings, closure of institutions, and Stephen also explained that we are collecting blood from schools, churches, from corporate organization, organized social groups. So it means that our blood collection is basically community-based. Right. And then we couldn't have the community gatherings. So everything just dropped. And if I have to give you the figures, the drop was really sharp.
Right.
The National Blood Service didn't have a previous experience on which to base any planning. But we quickly had to learn from other countries and what they had done and put an emergency plan to ensure that, first of all, we mobilize blood to be able to support our patients. And secondly, we also had to make sure that we are preventing community transmission of coronavirus during the blood donation. So we put together a plan, and we got help from the Ministry of Health, the COVID-19 task force. We got help from the media, from both local and external collaborators to develop a social media campaign, communication interventions, and we targeted 3 specific areas. The first area was donor recruitment. The second area was blood collection. And the third area was clinical transfusion. With donor recruitment, we had a campaign. We got key persons such as the First Lady of the Republic sending out messages, Queen Mothers from all around the country. We got Global Blood Fund supporting us, and the message, and then Daily Graphic, I need to mention, they publish day-to-day messages, and a lot of other media organizations. And the key message was that we need blood during COVID. Everything that we needed blood for is still here, so please donate blood.
And what was the response like?
The response was not very strong because people were scared, as I explained earlier. People were afraid to walk to where we do the blood collections. Nobody wanted to go near hospitals. Blood donation was not a priority. When people are scared and are worried, and there's a lockdown and there's economic stress, And so we needed to persevere. So we included a lot more activities, which will take time to mention. But then in implementing all of these, we also went to the clinic setting where we are collecting the blood and looked at all the physical distancing measures, the infection prevention, and made sure that we built confidence with our donors.
All right.
You know, that when you come here, you don't get infected by coming here.
Okay.
And then going from beyond that, we went to the hospitals and we told them, if you have a procedure or surgery, which is not an emergency, please reschedule.
Okay.
Because we are not collecting enough blood. And with all of these, we managed to somehow work on the situation with all the interventions that we put in place. We saw a slow but some increase in voluntary blood donations over the first 9 months of the year when we evaluated.
Okay.
In due course, I will share the statistics.
Right. Okay. If you've just joined us, it's about 28 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05. We're live with all the up-to-date, accurate, precise, unassailable health information. Today, we're zooming in, focusing on the National Blood Service. I have their Deputy CEO, Head of Research and Development, Dr. Lucy Asamoah Amoako. No, Akuoku, sorry. I get in trouble for that, right? Causing transfusion with regard to her name. Asamoah Akuoku. She's head of research and development. And I'll be very interested in partnerships. We've heard about drones delivering blood and so on and so forth. I'll hit on those exactly. What is the partnership? How much blood is being delivered by drones, if any at all, and so on. And then, of course, what are the key partnerships? Also, you may have heard of convalescent plasma, where we use antibodies from persons who've recovered from a disease, in this instance COVID-19, to help in the recovery process of persons afflicted by COVID-19. They've also started doing something with regards to that. We'll talk about that. And then there are key challenges that persons have accessing blood. Should you be the one chasing the blood? Should it be the health officials chasing blood? What is the procedure? And do you actually pay for blood or pay for its processing, as they say? If you have any questions, concerns, WhatsApp is 055 11 11 997. Ultimate Health on Joy 99.7. I have a very troublesome WhatsApp message from Ajiman Joseph. Ajiman Joseph, I don't know whether I should even entertain this. He's asking about whether the authorities of the service sometimes give out blood they receive for ritual purposes. I mean, he says there's an allegation that the authorities may do this. I really don't want to entertain this, but if my guests want to answer, I'll do that. Right. So WhatsApp is 055 11 11 997. Right. I don't know whether you want to comment on that. You know, sometimes.
Yes, I think it's very important to dialogue so that people understand what happens. So,
firstly, have you come across an allegation such as this?
Yes, I remember a few years ago there was a publication in the newspapers that blood had been given out for ritual purposes.
Really?
We want to reassure our donors and all our collaborators, our stakeholders, that we are a professional, an organization with very professional categories.
Right. High professional and ethical standards.
Right. We work with standard procedures. We are one of the few organizations where the work or the product that we work with can be traced from the time we collect it to the time it goes to the patient.
Okay.
And we have all of these audit processes in place. We do not give blood out for any purpose apart from what we have agreed with the donor to give the blood out for, and that is written on the donor information material. And if anybody has questions, we are always very happy to have these discussions. We can take you around the blood bank, the blood service, so that you look at the process that the blood goes through. So please do not be afraid. You are dealing with a very highly professional organization that is held responsible by ethical standards
Okay.
and
I think that does justice to it. But
professionals.
if you have your questions, your concerns,
you.
you can join us by WhatsApp 055 11 11 997. Ultimate Health on Joy 99.7 FM every Sunday is live on Facebook and YouTube, right? And our guests are from the National Blood Service, and of course we also have a donor. My regards also to Dr. Hiaji of the Lister Hospital, and my condolences again. He lost his father quite recently. I'm actually a member of that team somehow, so I'm aware of that. And let's keep the questions coming. But let me ask this, okay? New developments have come in, right? But as head of research and development, has there been any change in the blood service with regard to infrastructure, equipment, adoption of new technology and personnel? Because I've done this for almost 19 years or 18 plus, right? I'm wondering what has changed.
So a lot has changed. We are an organization that has to continuously review our standards in accordance with nationally and internationally accepted standards and in accordance with changes in the medical field. So in the past few years that we have been working together, I've been working with you for quite a while, we have had new infrastructure. That is the new building. We have had new equipment.
Okay.
We have revised our testing standards and then the methods. We have introduced a very strong research component to generate evidence on which to base our work.
Right.
You know, we are trying to use evidence-based approach to all the decisions that we make. We have introduced new technology. For example, we recently introduced the pathogen inactivation technology.
Okay.
And then
what does that mean for our listeners?
Pardon?
Pathogen
inactivation. So
right.
This is a process where we inactivate, after testing the blood, we take the blood through a process where we inactivate any additional pathogens that may be in the blood.
Okay.
So this is something we've looked at.
To make it safe.
To make it safe.
Right. We were not doing that before?
No, we were not doing. Pathogen inactivation is not done routinely.
Oh,
so this
okay.
is something that we introduced. We have slowed down because of resource limitations.
Okay.
But this is definitely...
So this is what, a recent, this year?
This went on for some time. No, not this year. I think up to 2018.
Okay, we've been doing that.
Yes, and
okay.
then we've had to slow down.
Right.
And then we have also introduced new components. For example, with regards to our communication with our donors, our clients, we introduced a donor
call center.
Okay.
So we are able to communicate with our donors and our clients. And we have introduced different research collaborations, research projects, which generate the evidence for us to be
right. Let me just come back here on the call center, a donor call center.
Yes.
So you want to be able to reach out to donors.
Yes.
Right. And what, you can call them in if you need blood of a particular grouping or?
No, we are using a more systematic donor tele-recruitment. So we call donors within 24 hours of donating blood. Once the data is sent to the call center, the donor is called and we thank the donor for donating. And we tell the donor when he or she is due to donate again. And then within a certain time to when the donor is due to donate, we send a reminder.
Oh, okay.
And ask them, tell them that they are due to donate. And then we also answer questions on where the donor can donate when he or she wants to visit the next time.
Okay, great. If you just joined us, it's 36 minutes past the hour of 2 on Joy 99.7 FM. I'm going through the emotions with the officials of the National Blood Service. We're going up close. Safe blood saves lives. But how do we get that safe blood? From you. The expectation is that voluntary blood donation should be the majority of our stock, right? I'll be finding out how long can we keep blood once we've got it? Does it stay forever? Is it like your bank account and it only goes down when you make withdrawals? They'll explain to us. If you have any questions, concerns, you can share them with us on WhatsApp 055 11 11 997. Okay, I've got this one from Dede in Maryland. Is the donation a year-round thing or just during the drive or campaign? If year-round, are there specific clinics, labs, or facilities where one can walk in to donate blood on a regular daily basis? This is where Dede is going with her question. Hang on to those. Let me see if I have a few more. This is from Akofa in Shire Hills. Please, how is donated blood stored or saved? And how safe is it for our different body systems? Thank you. There's another one here which says, hi, hang on, there we go. I used to donate regularly whenever Joy FM organized in the past, but I stopped after Joy stopped. Anytime I subsequently went to donate on a voluntary basis, I get turned away with the excuse that my blood type is too much, or there's too much of my blood type in the system, and so they would not allow me to donate, as it will only expire if people don't come to claim or use it, and that there are just some few people who can receive my blood type. What can be done in such a situation? My blood group is AB+. This is from Tom Brown in Tayman. Right? You want to address that?
Yes. So I'm not sure which questions to start from.
Right, let's start with Tom Brown.
Okay.
I like the name, Tom Brown.
So, Mr. Brown, I am not sure where you have been trying to donate. Although we do get a lot of AB positives, I think it depends on where you are trying to donate. Your blood is needed every day of the year.
Should it be dependent on where he's trying to donate? Is it not one blood service?
Yes, there are some hospitals that collect blood, smaller hospitals, and so they
designated blood collection centers.
Yes,
right.
So they may not. But if you go to any of the donation sites of the National Blood Service, because we collect the blood and distribute to hospitals, we are able to manage the stocks of the various groups, and we very much need your blood.
So how does a donor, a potential donor, know which facility is a blood or a designated blood collection point, such that you don't experience Tom Brown's problem? And I'll tie that in with Dede's question. Does it continue? Can you donate at various facilities across the year, or only when there's an organized campaign?
Yes, we need blood every day of the year. Every day there are people who need blood. And so there is the National Blood Service has the Southern Area Blood Center office in Kolebu.
All right.
There is a two other donation sites within Kolebu. There are donation sites in most of our hospitals across the region.
Okay.
And then there are the community donation.
Do they have any signage, any branding that shows that a person?
There are, but now Stephen will share the number. We have the call center number that can be called. You can send a WhatsApp or a text message.
Even if you're not yet a donor?
Even if you're not yet a donor.
You can use the call center to become a donor, to enlist?
Yes, to enlist. So for any questions, it's not just for blood donors, it's for all clients. So for any questions that
let's hit that straight away before we forget. Stephen.
So the number is 0277 501010. 501010.
Okay, 0277. That's Airtel Tigo.
Yes.
Right. 501010.
Yes.
That takes you to the National Blood Service
call center.
Call center.
And we also, in addition to the donation centers, every day where we're supposed to go to collect blood, we publish that on our website as well.
Yeah.
So if they go on our website, which is www.nbsghana.org, you will get that information from there as well. Okay. So it gives you the day-to-day centers that we're supposed to collect blood.
Is there an NBS app?
No, the app is not ready yet. So currently we're just depending on our WhatsApp line and then the call center.
Okay. What does it mean when you say it's not ready? The politicians say that a lot.
It's in the pipeline.
It's in the pipeline, meaning you have an app?
The app that is not an NBS Ghana app, but is being developed by a collaborator, Casons, and that is the blood ambassador.
Right.
And I think it's far advanced, so we will be.
So we don't have an app.
Yes, we don't have an app.
Okay, right, okay. Just in case somebody else wants to rush in and overtake cases and give them a good app, hey, this is where the news is, okay? I don't know what agreement or contractual arrangement they have with cases, but I would like us to have an app. And then years ago, I was part of a very serious committee, and one of the things we're seeking to do was to be able to have a data management system that allows you to look on a screen and tell this type of blood is available at this hospital or this blood center. Do we have that now?
The SMS, no, we didn't have that. We have a donor database, but that has been implemented at the Southern Center in Accra, and we are still working on getting it across the country.
A donor database is different from what I'm talking about. I'm talking about a database that allows you to know that if I'm sending somebody to Ridge Hospital, they actually have this stock of these different blood groups. Do we have that?
No, we don't have that.
We still don't have that.
We still don't have that.
Oh my, oh my, oh my. Okay, WhatsApp is 055 11 11 997. Okay, this one says, I'm Gordon Frank Anala in Ejura, Ashanti. I believe that voluntary blood donation could be made to be attractive and fun so as to rope in a lot more willing people. Imagine you walking around with something like a badge or something showing to everyone that you are a cherished partner of the blood service. It could be in levels like bronze donor, silver donor, gold donor, platinum donor, right? Each level with its own privileges, right? Something I was coming to in my next batch of questions. But he's talking about a kind of an incentive campaign which encourages people to become donors. Do we have anything like that? I know there are little things that you get when you donate, but do we have anything as structured as this?
We have had that, which are the badges that he's talking about, T-shirts, key holders.
Okay.
We have sometimes executive bags or the small students' backpacks, which are branded.
All right.
Yes. So we are taking advice from what is just suggested. That is the
app.
No,
the app and then the incentive
the milestone,
system.
the milestones.
It's just like being a premium customer of a bank, right? You get certain privileges, and every time we do this, we get these kinds of questions. So we need to start implementing some of these. It's like a behavioral management program. We're encouraging people to do something and to feel good about having done it, right? And if we catch them very young, I know the cutoff is 18. You have to be 18, 17 and above,
17.
right? But we should start teaching the blood donation things and issues from very early on, so that by the time they are 18, 17, they are ready to donate.
So, in addition to that, we have our calendar. On our calendar, we have World Blood Donor Day and then the National Blood Donor Day celebrations. So on National Blood Donor Day, what we do is that we try to recognize our donors, especially those who have more than 50 donations and above.
Okay.
We recognize them.
Yeah.
Just last Monday, that's on the 30th of November, we had a National Blood Donor Day.
Yeah, you do that with Rotary, don't you?
Yes, we did that with Rotary.
Well,
it has always been a Rotary collaboration with the National Blood Service.
Okay.
So all these donors, nationally, regionally, we recognize them, the best female donor, best youth donor, and all that. I think that is motivation.
But over and above and beyond that, right, we need competition. Look how keenly contested the National Maths and Science Quiz is, right? We can have schools contesting on blood donation and other things.
That is ongoing. The inter-schools blood donation contest.
Well, we need to pick it up.
We have.
Okay,
that.
right. Why is it that you do not accept blood or people with tattoos and weed smokers? This is from Abel. Is that the case? I know about tattoos and body piercing. I've heard about that. But weed smokers, do people answer questions on whether they smoke weed?
I think the questions are on drug use, recreational drug use.
Okay.
Yes.
Right. Okay. Hi, Sir Nortey. Namaste. What happened to Joy FM's May Day and Farmers Day voluntary donation? Please let your guests clarify all the myths around blood donation. Solomon in Domahenkro. All right, I'll come back to that. For how long does it take you to get a card after donating blood? I donated this year, February. Till now, I still have not received my card. could there be any reason which blood group is advisable to donate? And in a year, how many times can you donate? Douglas from DC.
So all blood groups can donate. And in a year, you can donate 3 times. That is donating once every month.
Okay. Right.
And the time it takes you to get your card should be latest by the next donation, which is within 4 months.
Okay.
But if possible, it should be earlier. So we are entreating all our donors. We are using the donor contact center to try and address some of these issues that come up. It helps us to put in place corrective measures and preventive measures. Please WhatsApp us on 0277 501010.
Okay.
And we will
Right. Why does it
address your
take
issue.
about 4 months to get your card?
It should take earlier. I'm using that for because the persons directly dealing with the card are not here, so I'm not sure what the challenges might be.
Okay.
But the blood is tested within 48 hours, and if all the documentation is in place, a maximum of 1 week, we should have prepared the card.
All right, great. My bloodline is activated 0302216541 0302216541. Talking to the officials of the National Blood Service. I have blood donor Josephine Anand Dennis with us, and then of course the PR Stephen Adai Ban and the head of research with me. Let me ask this question quickly whilst we're waiting for a couple of phone calls and I read a few more messages. The convalescent plasma, right, with regard to our current situation with COVID-19. Can we just quickly explain that and how one gets on board for that?
So Nortey has already told us what the convalescent plasma is, and so we are taking plasma from patients who had COVID-19 who have recovered and are in good health to donate.
Okay.
And then we transfuse the plasma to patients. In our case in Ghana, we are now giving it to severely ill patients. And by so doing, we transfer antibodies, which provides immunity and helps the patient fight the disease.
Okay.
So what we are doing is that we try to recruit persons who previously had COVID-19
Must have been conclusively diagnosed.
Right.
And they
Either
must have recovered.
by the antigen test or antibody test, must have recovered at least 14 days prior to donation. And then we also test for the antibodies in the donor. We take the sample at the same time.
Okay.
And then we process, and the doctors who are treating the patients who have COVID-19 decide on which patient qualifies to donate.
Okay, so we're doing that in Ghana now.
We're doing that in Ghana now, and what our biggest challenge has been getting donors, convalescent plasma donors, because we started on 14th of October collecting, and so far we have had 14 donations.
Okay.
So that is a very big challenge for us.
Okay, 0302216541. Those are the healthy buttons to push to get in on the blood discussion. Let me ask this. Other countries are testing all blood they collect, right, for antibodies, and to see if they can also generate convalescent plasma from that. Are we doing that?
So we have put a program in place, and this is an all-African program to look at all donors and look at the level of antibodies, and this will help us to be able to look at, first of all, the actual prevalence in the population, because the donor population is a relatively healthy population, and then recruit people who may have antibodies. Note the challenge with working in a resource-limited country is resources. So we have started a lot of projects and very actively with other countries. Our colleagues from the much more resource available countries have gone ahead of us, but we haven't given up.
Okay. I almost said something about beyond date, but I won't go there. Can a virus-infected person donate blood to the blood bank? Would the blood be used at all? This is from Ernest Edifo in Takrady.
Ernest, so I'm not sure which virus.
He mentions HIV, for example.
HIV, no. You cannot donate for the simple fact that if we transfuse the blood to another person, the person is going to contract the disease. Okay. So in blood donation and blood transfusion, we do two very key things. We try to protect the health of the donor. So if the donation is going to affect your health, we don't take blood from you. And then we protect the health of the patient. So if your blood is going to harm the patient, we do not take blood from you.
Okay.
But we try to look at this, and we give you the information in the best way possible, and also advise you on the way forward to having the health condition attended to.
Okie dokie. Nortey, good afternoon. My auntie was a regular donor then back at Kolebu, but she stopped when my mother needed blood urgently, and she showed her card for my mom to be given the blood that she donated later. She was turned down because she's not the same as my mom. This has made us, the siblings, stop donating freely unless a friend or family member needs it. This might explain the increase in family or replacement donation. The hospitals are not helping. This is from Solomon in Amasaman. Any comments on that?
Yes, Solomon. We are talking about voluntary donation, which is that you donate for the good of another person without expecting anything in return. When you donate blood, it stays on the shelf for 35 days. And we already have a shortage of blood. But we have people presenting cards from as far back as the 70s or 80s and asking for their blood back.
All right.
Me and you should know that this is not possible.
Okay.
The misnomer is that the blood bank is called the blood bank. It's not a bank. It's where we keep the blood. So we keep the blood for 35 days.
You don't guarantee any withdrawal.
And yeah, we cannot guarantee
you don't get
that
a statement
the
of
blood will
account.
be there. And we keep the statement of account for the purpose of your health, for the purpose of recognition, but not so that you come back for it.
Okay.
I would want to plead with Ghanaians. We started blood donation in Ghana on a pretty much wrong footing. We started with incentives, with Milo and milk. We started with asking people to come back for their blood.
That's our kind of language, isn't it?
This is not done anywhere else because it's not sustainable.
Right.
So we are asking Ghanaians to donate for the good of another person. That person might be you. I would want to respond to this by saying that if you keep your blood and want to donate it when your relative needs blood, if it's an emergency, blood will have to be given to that person. And when we take blood, we need to take it through a process that might take up to 48 hours. That blood will not be available.
Okay.
So it is not the best stand to take with regards to blood donation.
Great. This one says, Cosby says, I'm over at 20. He donated over 20 times. He walked to one hospital after 12 noon one time and was told he could not donate after 12 noon. And that if I want to donate, I should come early. I was just heartbroken. Is there a time to donate?
Yes, there is a time to donate.
Really?
And that time is within the working hours of the blood center. At the Southern Area Blood Center, the working hours are from morning till about 4 in the afternoon.
Right.
When we have mobile blood donation sessions, we stay there until the last donor has left.
Okay.
But if you need to come in early because of your schedule, or you need to come in a bit later, please let us know. 0277501010.
So you actually have closing hours, at least for donation?
Yes, especially during the COVID, we had to extend our hours to be able to meet the needs of people who were working and coming in.
Is it a matter of personnel, logistics? Should we be turning people away who want to actually donate blood?
I think it's a matter of personnel. We have a staff that work one shift from 8 to 5.
Wow.
And we need to make sure that they are not burnt out and they are able to.
Right. Bila and I will come and do something about that. I think that there's some marketing we need to do. For example, with the incentives, I agree with you. We may have started on the wrong notes, but I don't see how we can't partner with ShopRite, Game, and other people, give vouchers and stuff like that, and people will donate. We've got to be creative, and you're ahead of research and development. There are ways we should be able to get into this, all right? You donate a certain number of times, MTN gives you a power bank or something. All right, but we should not be pushing people away when they want to donate, and then we say we have less than the optimum stock of blood that we need, or because you let them go and sponsor, mentor, Most Beautiful, and other things. These are really things we can do. Bila is nodding, and I know we can swing this. right?
Thank you very much. I want to respond to that.
Yeah.
So we have depended on our donors, collaborators, for example, for the award for the National Blood Donor Day, and then for all the programs that we hold. We hold with Joy FM, we
Yeah.
go out. I think the challenge with the different kinds of sessions that are held is that there is no standard. When you move from the National Blood Service facilities and you go to other facilities, you realize that some people are over incentivizing, and that affects the quality of the blood.
Right.
So blood donation behavior is such that, first of all, donors who donate voluntarily are happy to save lives.
Yeah.
And the moment you give something that amounts to paying them for the blood, they become a bit unhappy. There is a donor here, and I'll find out from her. So when donors who really are committed to donate are getting incentives as appreciation,
It's
and
just like giving somebody a tax incentive, okay, to facilitate the business growth and
Yes.
so on. So
Yes.
it is not payment. We
Yes.
must drive the communication to make sure that whatever you receive is well understood. But I'm looking at a situation where I've done this for 18 years and I still find that we're still challenged there. And I don't envy you at all. I don't want to be head of research and development in a resource constrained area. But we must look for these new bridges, right? Without people thinking that it is for it is payment in receipt of blood, and such that they'll think that we are selling blood. All right. So that's the point I was making. Let me just quickly rattle off these. Unfortunately, we've run out of time, but we will come back post-election because blood will still be needed after the election. I don't want to say especially after the election, right? Hi, good afternoon. Please, I'm Freddie Nakusumbo. Can people living with sickle cell donate blood?
no, we do not advise you to donate blood if you have sickle cell disease, because donating blood can affect your own health.
Okay. Is it only HIV and look at Ajiman? You've written halitosis B, halitosis. I said totis. Tosis B. Hepatitis. You wanted to write. Is it only those tests you do on donors?
Ajiman, we test all donated blood for HIV 1 and 2, hepatitis B, hepatitis C, and syphilis. But we advise that if you have any infection, or if you think that you are at risk of any infection that can be transferred to the donor, please do not donate, or at least discuss with our nurses to advise you.
Right.
We've
We've run out of time, but the last thing I want to ask you, has the Blood Service Act been passed?
No,
Is it at Parliament?
it's at Parliament.
Still?
Yes.
Okay.
We were hoping that it would be passed before now,
Right.
before the election. And
Will it affect your vote?
no, it will not affect
kidding.
my vote, but we need it to be able to do most of the things that have
Right.
been suggested today.
Right. Thank you very much, Dr. Lucy Asamoah Kwoku, Head of Research and Development. Stephen Adaiba is Head of PR Communications, or Communication Officer, right? And Josephine, thank you so much. I will have you three in again next week, okay? Because I want to go into the policy, the act. I know why I asked that question. And then the procedures, whether we are charging, processing, and so on, and where the matching and all those things that really, really frustrate families and donors in distress, right? So many thanks again for sharing with us. We said save blood, save lives, saves lives. So let's bear that in mind. Next week we'll come back.
Thank you very much.
Yeah, Bile is up next with the Sunday Rhythms, which, irrespective of your blood group, is very, very good for you. Stick and stay on Joy 99.7 FM.
I'm Reverend Dr. Cyril Gershon Fayose. I'm the General Secretary of the Christian Council of Ghana. Peace is the cornerstone of every nation's development. And we have enjoyed peace in Ghana for the last 20 plus years. We must do everything in our power to protect it. You do not know what you have until you lose it. So as we all march up to December 7th,